healthcare expert, explains why intimacy in old age should not be overlooked.
Doctor, I am 55 years old, and my husband is 68 years old. But for nearly 2 years now, there have been many changes in our bedroom activities. He demands intimacy every day. Before, it was only 3 to 5 times a month. He has desire, but I have been menopausal for 6 to 7 years. I advised my husband to get a checkup, but he refused. Doctor, I would like to ask if an increase in such activities at nearly 70 years old is abnormal.
Yes, we have received this heartfelt sharing from an anonymous listener. Warm greetings and best wishes for good health to our dear readers. Today, we will discuss a topic that is rarely addressed openly, especially in later years. Yet, precisely because of this, it is an important subject that deserves to be shared with sensitivity and respect. The title of this discussion may surprise you. Doctors warn, if you stop having intimacy in old age, this will happen to you. But please do not misunderstand. This is not merely about physical matters. It is a comprehensive story about mental, physical, and emotional health. Intimacy in any form is not just for the young, it is a vital sign of physical and mental well-being for older adults. Before diving deeper, we kindly invite you to take a moment to consider an important question. Do you believe that emotional and intimate life still matters at the age of 60, 70, or even 80 and beyond? Please share your thoughts in the comments below. Simply write "agree" if you think it remains important, or "uncertain" if you are still hesitant. Why is this topic being addressed? Because an increasing number of medical studies show that older adults should not overlook their need for emotional connection and closeness. This is not about mere desire, but about the fact that our bodies and souls still need love, affection, and connection. This discussion will be presented in a respectful, non-offensive manner, aligned with our family and cultural values. We invite you to relax, prepare a warm cup of your favorite tea, and join us as we explore what truly happens to our body and mind if in old age we completely abandon emotional and physical intimacy. Part 1. A common misconception. One of the most widespread misconceptions in society is that intimacy is only for the young, that after age 60, people no longer need closeness or intimacy. However, according to the World Health Organization, WHO, intimacy is a part of overall health at every age. If an older person still desires closeness with their partner, it is neither shameful nor abnormal. On the contrary, it may indicate that their body and hormones are still functioning well, their mind remains sharp, and their emotional relationship is still nurtured. Some geriatric specialists even assert that a healthy, intimate life in old age is a sign of vitality, absence of depression, and a good quality of life. We all know that aging brings changes. Women experience a decline in estrogen, men in testosterone. But this does not mean intimate life must end. What changes is merely the form, frequency, and expression. For instance, physical intimacy may occur less often, but a hug, a touch of the hand, or an affectionate conversation can sometimes convey love more deeply than in youth. This is what we need to understand together. Growing older does not mean stopping love or being unworthy of love. Intimacy is not just physical, it is about connecting hearts, feeling close, and cherishing one another. Thus, when an older person still desires closeness with their partner, it should not be mocked, suppressed, or hidden. On the contrary, it is a sign that their soul is still alive, still moved, and still connected to the one they love. Part 2. What happens if older adults completely abandon intimacy? Dear readers, all physical changes that come with aging are natural. But if those changes result from self-imposed limitations or withdrawing from what remains healthy, we need to reconsider. When an older person has no physical or emotional closeness whatsoever, a range of negative effects may emerge, including 1. Decline in mental health. A prolonged absence of intimacy can lead to loneliness, feelings of being unwanted, loss of confidence, and eventually mild depression or lack of motivation to live. 2. Circulation and muscle issues. Gentle, affectionate acts like hugging, kissing, or caressing can promote blood flow and maintain muscle strength. Without these, circulation may decrease, joints may stiffen, and muscles may weaken. 3. Weakened immune system. Research shows that those with a healthy emotional life have stronger immunity. Without closeness, older adults are more prone to flu, infections, or prolonged fatigue. 4. Increased risk of cardiovascular issues and high blood pressure. Healthy intimacy can lower blood pressure and regulate heart rhythm. Conversely, prolonged emotional stress from a lack of intimacy can lead to hypertension and heart disease. 5. Loss of connection with a partner. A subtle but often overlooked effect. When couples stop touching, hugging, or having loving conversations, their relationship can fade. Feelings of distance or disconnection can make partners feel like strangers despite years of closeness. We invite you to reflect and share. Have you ever felt emptiness or loneliness from a lack of closeness with your partner? Please take a moment to share a brief experience in the comments. Your stories could inspire and support others on their journey. Above all, please remember that this is not a sign of weakness or shame, but a part of overall health, encompassing physical, mental, and social well-being. What does medicine say about the benefits of intimacy in old age? Dear readers, we live in an era of increasing openness. Today, medical professionals encourage honest discussions about the emotional lives of older adults, as the benefits are not only emotional, but also scientifically proven. 1. Strengthened immune system. A study from Wilkes University, USA, found that older adults with a healthy, intimate life have higher antibody levels, improving resistance to flu and minor infections. 2. Lower blood pressure and cardiovascular protection. Research from the American Journal of Cardiology shows that intimacy lowers systolic blood pressure, offering benefits similar to light exercise, but in a more pleasant way. 3. Improved sleep quality. After closeness, the body releases oxytocin and endorphins hormones that promote relaxation and better sleep, especially helpful for older adults with insomnia. 4. Enhanced memory and brain function. A UK study found that older adults with a stable, intimate life have better memory and cognitive function, with fewer early signs of dementia. 5. Increased happiness and reduced stress. When partners express love healthily, the body releases dopamine and serotonin, hormones that promote joy, peace, and optimism. In summary, not only is a healthy, intimate life possible, but science proves it helps older adults live longer, healthier, and happier lives. However, intimacy does not always mean strenuous physical activity. This brings us to the next part. Is intimacy always about physical intercourse? In old age, the meaning of intimacy can be broader, gentler, and even more profound. The question is, does intimacy in old age always have to involve physical intercourse? The answer is no. Intimacy is about care and connection between two souls. In youth, physical passion often takes precedence, but as we age, comfort, closeness, and trust become paramount. Thus, intimacy in older age can take simpler forms but carry deeper meaning. For example, holding hands while sitting together, embracing before bed, gently stroking a partner's cheek or hair during a quiet conversation, listening attentively, or sincerely saying, "I love you." These are all expressions of healthy intimacy. The goal is not just the act, but the emotional connection that brings peace to the heart and makes the body feel cherished. Intimacy in old age is more about loving communication than mere physical activity. According to Dr. Linda DeFillers, a clinical psychologist specializing in intimacy in older adults, the key to intimacy in later years is not frequency, but quality and emotional closeness. In other words, a warm morning hug can be as valuable, or even more so, than physical intercourse, as it strengthens bonds and understanding built over decades. But let us be clear, while intimacy does not always mean physical intercourse, open communication about needs and comfort remains crucial. Healthy communication helps avoid awkwardness, fosters mutual respect, boosts confidence, and, most importantly, strengthens relationships over the years. Now, we invite you to share. Do you feel closer to your partner through gentle touches or warm conversations? Please share your thoughts in the comments, as your experiences may inspire other couples reading this. In the next section, we will explore why many older adults begin to lose desire or even feel fear when thinking about their intimate life. Is this a normal part of aging, or is there something we need to pay attention to? Dear readers, the loss of desire in old age is often overlooked or dismissed. However, this is a critical topic, as it directly impacts overall quality of life. So why does desire often diminish with age? Let us explore some common reasons. Here is the translation of the provided text into English, adhering closely to the original meaning and structure, without using hyphens or dashes and maintaining the same paragraph breaks. First, hormonal changes. In women, especially after menopause, a sharp decrease in estrogen levels can cause vaginal dryness and reduce desire. In men, a decline in testosterone affects both desire and erectile function. These changes are natural but can diminish sexual life. Second, health issues and medications. Chronic conditions such as diabetes, high blood pressure, heart disease, or thyroid disorders can impact desire. Additionally, many medications used to treat these conditions, such as antidepressants, blood pressure drugs, and sedatives, have side effects that reduce desire and sexual performance. Third, psychological and emotional factors. Anxiety, stress, or even depression can lower desire. Furthermore, self-consciousness about bodily changes can make older individuals feel less attractive, reducing their interest in intimacy. Those who feel unappreciated or have a strained relationship with their partner often lose desire due to a lack of emotional connection. Fourth, neglected relationships. When couples lack intimacy or emotional connection weakens, desire tends to fade. Poor communication or unresolved conflicts can make a relationship feel more like roommates than partners, making sex feel distant. Fifth, fear and anxiety about sexual activity. Many older adults worry about pain, performance issues, or feel embarrassed. These fears limit the desire for intimacy, even if the body is still capable. Finally, past trauma or negative experiences can also affect desire, such as the loss of a loved one or negative sexual experiences, making it difficult to open up or feel comfortable in a relationship. The good news is that reduced desire in old age is not insurmountable. There are many medical and natural methods to improve sexual life and intimacy, which we will explore further in the next section. We warmly invite you to share your thoughts. Have you experienced a decline in desire as you age, or have you found ways to overcome it? Please share your experiences in the comments so we can learn from and support each other. Now, let's discuss medical and natural solutions to restore sexual desire. After understanding the causes, it's time to explore solutions to improve. There are many ways to restore intimacy and enhance the quality of sexual life in older adults, including medical treatments and natural approaches. First, medical treatments. Some individuals may need medication, especially when the cause is hormonal changes or medical conditions. For example, women can use estrogen therapy to address vaginal dryness through topical creams or oral pills to improve moisture and comfort during intercourse. For men, Testosterone therapy can enhance desire and erectile function, particularly in those with significant hormonal decline. Medications for erectile dysfunction, such as sildenafil, Viagra, or tadalafil, Cialis, are highly effective but require a doctor's consultation to avoid side effects and drug interactions. Second, alongside medical treatments, there are many natural alternatives that can help boost sexual desire in older adults in a gentle way, minimizing the dangerous side effects often associated with conventional treatments. Some herbal remedies can improve desire and sexual health, thereby enhancing quality of life. For example, ginseng is known for its positive effects on boosting energy and sexual vitality, while ginkgo biloba can improve blood flow and enhance sexual function. Maca, a plant from South America, is also recognized for its ability to improve sexual quality. Nutrition and supplements. Certain foods and healthy supplements can also support sexual health in older adults. Avocados are rich in healthy fats that improve blood circulation. Fatty fish like salmon and sardines, high in omega-3 fatty acids, support blood flow and heart health, both closely tied to sexual function. Vitamin D is known to boost testosterone levels, a key factor in male sexual desire. Regular exercise. Exercise brings numerous benefits, such as improving blood circulation, increasing stamina, and enhancing overall physical health. Gentle activities like walking, yoga, or light exercise can improve blood flow to reproductive organs, reduce stress and anxiety, and boost energy and endurance. Kegel exercises for women. Kegel exercises strengthen pelvic floor muscles and improve control during intercourse. These exercises not only help prevent urinary incontinence, but also enhance pleasure. Third, counseling and psychological therapy. If sexual issues stem from emotional or psychological factors, therapy can be highly effective. Couples counseling improves communication and resolves relationship conflicts. Sex therapy with a psychologist can address past trauma, anxiety, or other psychological issues. Are these solutions effective? Most older adults who have tried medical treatments or natural methods report improvements in their sexual quality of life. Of course, everyone is different, and no single solution fits all. The key is to find an approach that suits your needs and consult a qualified doctor. Now, we invite you to share your perspectives. Have you or your partner tried any of these solutions? Which method do you find most effective? Please share your experiences or questions in the comments, as we can all learn from each other. Dear ladies and gentlemen, there are many misconceptions about sexual life in old age. Many believe that the older you get, the less capable you are of enjoying a healthy sexual life. But is that true? Let's uncover the truth behind some common misconceptions. First misconception: older people no longer have sexual desire. Many believe that as you age, sexual desire automatically disappears and sexual life becomes meaningless. The truth: although physical and hormonal changes may occur, many older adults maintain sexual activity and find joy in their sexual lives. With the right approach and proper medical care, sexual desire can persist. Second misconception: older people are no longer capable of sexual activity. Physical decline or erectile dysfunction in men leads many to think that old age means the end of intimacy. The truth: many older adults can still engage in satisfying sexual activity. Physical decline does not mean the end of sexual life. With suitable positions and mutual understanding, intimacy can be maintained. Third misconception: older people don't need sex because they can't conceive. Some believe that when reproduction is no longer possible, sex becomes unnecessary. The truth: sex is not just about reproduction, but also about emotional connection, intimacy, and mental health. For many older couples, sexual life holds significant emotional value. Fourth misconception: sex in old age offers no health benefits. The truth: a healthy sexual life in old age provides many benefits, such as improved blood circulation, reduced stress, better sleep, increased happiness and confidence, and even pain relief, especially for women with joint pain. Fifth misconception: older people no longer have desire. The truth: sexual desire in older adults is influenced by physical and mental health. If desire decreases, it's often due to medical conditions or psychological stress, which can be addressed. Final misconception: sex in old age is taboo. The truth: sex is a natural part of life, regardless of age. The more open we are in discussing it, the easier it is to break stereotypes and support older adults in maintaining a healthy sexual life. In summary, older adults can absolutely enjoy a fulfilling sexual life. If you or your partner experience a decline in desire, don't hesitate to explore and choose suitable solutions together. Dear ladies and gentlemen, after exploring solutions and truths, let's now consider practical ways to maintain a healthy and happy sexual life in old age. Maintain physical health. Health is key. Engage in gentle daily activities. Walking, cycling, yoga are all great for blood circulation and stamina. Kegel exercises are particularly recommended for women. Eat a balanced diet. Include fatty fish rich in omega-3, vitamin E, nuts, fruits, and antioxidant-rich vegetables. Limit foods high in sugar and saturated fats. Get enough sleep. It helps the body produce hormones that support sexual life and restore energy. Maintain open communication with your partner. Communication is vital for maintaining closeness. Don't hesitate to share needs and preferences, even things that make you uncomfortable. Couples who understand each other can more easily maintain intimacy. Don't forget romantic gestures, hugs, kisses, holding hands, small acts that nurture emotions. Create a suitable environment for intimacy. A clean, quiet living space with soft lighting, gentle music, or pleasant scents can enhance feelings of closeness. Reducing stress through meditation, reading, or traveling together is also a great option. Try alternative solutions when needed. If facing physical challenges like vaginal dryness, often due to menopause, use water-based lubricants. Respect your body's limits and don't rush. Intimacy doesn't always mean intercourse. It can be warm moments spent together. Consult a doctor or sex therapist. If facing serious issues like erectile dysfunction, vaginal dryness, or psychological problems, seek help from medical professionals. Hormone therapy or medications may be needed, but they must be prescribed appropriately. If the cause is psychological, sex therapy can be an effective option to help both partners understand and support each other. From an empathetic perspective, we invite you to share. Which step will you start with to maintain a healthy sexual life? Do you have any tips or experiences to share? Let's discuss in the comments below. Dear ladies and gentlemen, we've reached the end of today's video. We hope the shared content has provided you with useful information and inspiration to continue nurturing a healthy sexual life, regardless of age. Intimacy is a right for all ages. It's not just about physical connection, but also the emotional closeness we build with our partner. No matter your age, everyone deserves to enjoy happiness, love, and passion in life. If you feel your sexual life is cooling off, remember there are many ways to maintain relationship quality and foster intimacy with your partner. Start with open communication, care for your physical and mental health, and don't hesitate to seek medical support if needed. The final message from experts is this: there is no age limit for intimacy. Don't hesitate to care for yourself, nurture your relationship with your partner, and maintain a positive mindset. A healthy sexual life not only benefits physical health, but also enhances mental well-being and overall happiness. If you found this video helpful and insightful, please like the video and subscribe to the channel to stay updated with more engaging content. Don't forget to share your thoughts or ask questions in the comments. We look forward to hearing from you. Thank you for watching. Wishing you health, happiness, and abundant love. happiness and abundant love. Happiness